But if you have a swollen prostate, then obviously you're going to have some issues with urination, specifically frequent urination. You're waking up at night because it does cause some pressure or a smaller bladder. So you'll have some problems, obviously, with starting urination, stopping urination. So if you got a swollen prostate, we call that benign prostatic hypertrophy or growth of the prostate. Here's one of the things that are really the thing that is driving the growth of the prostate, and it's really hormonal, and that's known as DHT or dihydrotestosterone. DHT is about 10 times more virulent, more powerful than just testosterone, which is why it really can cause some accelerated growth with just long-term exposure to that hormone of the prostate. This is also why it can also kill off the hair follicle, can cause balding and things like that. But you can actually test for this, and this is actually called the 5-alpha reductase pathway. Well, how do you know if you're very heavy on this 5-alpha reductase pathway? Well, you can actually test for this, and in fact, a Dutch test or a dried urine total comprehensive hormone will be very clear that this is actually going on. But also, some men too, if you test for it in the blood, will be very high in DHT. There are certain things like reishi mushrooms, if you've ever heard of saw palmetto, but lifestyle, guys, is going to be the most important things that can help shunt that pathway away from the 5-alpha reductase into DHT in order to shunt that away from there. And I think that actually reishi mushrooms are actually one of the best things in order to do that. But it's got to be supported by your lifestyle. And one of the biggest things that can drive that pathway is going to be insulin resistance, which does lead to having elevated blood sugars and things like that. So very, very important to make sure that you're working with someone who knows how to test for these and running the right tests in order to be able to see that this is happening and knows what to do in order to help kind of blunt that pathway from getting worse, but at the same time, make sure that you are changing your lifestyle that could be causing it.